New at 4:30, straight talk from the CEO of Strong and Highland Hospitals.
I don't want to sugarcoat that we have some difficult years ahead.
How federal cuts will impact the area's largest private employer and our local healthcare system. The University of Rochester has been working to understand how deep the impacts will be for employees and to the people, all of us, who they serve. News 10 NBC investigative reporter Jennifer Lukey joins us live from Strong Hospital. And Jen, you've been asking for a sit-down interview on this topic since the federal bill passed. But I understand they wanted to take some time to fully understand the situation.
Yeah, that's right, Nikki. And they still really don't have all of the answers. And that's because some of the funding cuts have been restored. Others are being fought in court. And some of the changes to health care don't go into effect until 2026 and 2027. So there are still a lot of unanswered questions. But university leaders did get together recently for a webinar where they discussed some of this. And I was able to see that webinar.
Just because you read bad things happening and thousands of people being laid off at other institutions doesn't mean that's what's going to happen here.
The president of the University of Rochester addressing some of the nearly 30,000 people the university employs.
We have survived, and we will survive this too. It won't all be easy, though.
The biggest impact will likely be to UR Medicine's medical centers, which serve hundreds of thousands of people across upstate New York.
At the moment, it's difficult to estimate with complete certainty what the impact these cuts will have on our health system.
While those who are entitled to Medicaid should still get it, they'll have to prove they either meet the new work requirements or should be exempt. While there is concern that the paperwork burden will cause people to just give up, the bigger worry at this point is for the lower middle-class families on New York State's Essential Plan. That was a cheap option for coverage established under the Affordable Care Act. Most people know it as Obamacare.
The federal subsidy is going away, and the cost of it is being shifted to New York State, and it creates a significant problem for New York State's budget, probably to the tune of about $3 billion.
The Hospital Association of New York State estimates that in Monroe County alone, more than 40,000 people could become newly uninsured, and another 65,000 in the counties that surround us. Counties where people rely on smaller hospitals for their care. The only silver lining for our rural hospitals is that most of them are part of larger healthcare systems.
Together, we're really stronger. There's very few rural hospitals that can go it alone based on these headwinds. And I think we had a real jump start on building this network of UR Medicine. And so it positions us in a much better place than a lot of rural hospitals and rural healthcare systems are dealing with.
And of course, UR Medicine and its hospitals aren't the only ones bracing for these federal cuts. These same discussions are happening at Rochester Regional Health as well, which has a number of hospitals, both big and small, Nikki. So this is something that we will continue to follow in the coming months as it really comes into focus just how badly they're going to be impacted by these cuts.
And Jen, back to the U of R, aside from the medical center, it's also lost millions of dollars in research grants, right?
Yeah, that's right, Nikki. I want to make sure I get the numbers straight here. They've had 20 federal grants terminated, which has led to an estimated loss of about $9 million in federal funding. Now, $9 billion is a lot of money for a lot of us, but U of R has about a $500 million research budget, so it is significant, but it is not detrimental, they say, to moving forward hundreds of research projects that are ongoing in this community.
All right, Jen, thank you. U of R leaders also report at the moment they are managing any budget shortfalls through attrition.